changer. And I'd love to get your thoughts. Maybe just explain what low dose naltrexone is and how it can help people.
Sure. There are two things. There's low dose naltrexone, which you alluded to, and then there was ultra low dose naltrexone, which you use for the opioid reduction. I'll speak about low dose naltrexone first. Naltrexone was a drug that was invented or made for opioid addicts, okay? And it was given at a relatively high dose, 50 milligrams. There was a gentleman back in the 80s, his name is Dr. Bahari, who unfortunately passed away a few years ago. He used 1/10 the dose, or less than 1/10 the dose, back in the early 80s during the AIDS epidemic. And he found that the AIDS patient, now remember, in the early 80s, when a person had HIV, it was a death sentence. It's not today. There was nothing out there.
So was naltrexone created for AIDS patients?
The naltrexone was not created for AIDS patients. It was initially created for people with opioids. But this Dr. Bahari, for opioid addiction. But Dr. Bahari, I don't know how he came about using it, but he did find that using this at a very, very low dose improved the immune response. So he used it on his AIDS patients, then he used it on cancer patients, and he found that many of these patients were living longer and doing quite well. He then used it on patients with Crohn's disease or other multiple sclerosis and found that it reduced the progression of many diseases and helped them a lot. And a lot of other doctors adopted it. Now, fast forward many years, we know that using low-dose naltrexone, and this is naltrexone at doses at less than 4.5, can be used to aid many different things, including people with multiple sclerosis. There were and MS. There's some studies from Stanford University that showed this is a tremendously important medication for fibromyalgia. There's some people at Hershey Medical Center who's studying this for Crohn's and ulcerative colitis. There's a doctor out in I believe, Arizona who's doing this for patients with pancreatic cancer, for example. He mixes it with something known as alpha-lipoic acid. So there's a lot more acceptance of low-dose naltrexone for autoimmune conditions than there were just a few years ago.
Wow.
And I've had some gastroenterologists, for example, tell me they've seen some presentations at conferences. So it's a lot more popular, a lot more prescribed. And again, my best successes are with Crohn's, and it works really well with Crohn's, with MS, and with fibromyalgia. Those are the biggies. Now,
what? Oh, sorry to cut you off. I was going to say, what is the mechanism? What is this? Sounds like very powerful.
Your opioid levels peak twice a day, roughly 2 in the morning and a little bit in the afternoon. It's not as big of a peak in the afternoon.
Yeah.
Now, what this does is this causes a temporary block for a few hours of the opioid production. And by blocking something, you're actually going to increase the amount of the production of the endogenous opioids. These endogenous opioids do not make you high. What they do is they modulate the immune system. And we know there's more and more research coming out how these specific type of opioids are immune modulators. And the low-dose naltrexone does exactly that. It helps modulate the immune system. Now, there's now, we used to give the medicine once a day. There's now more evidence that if you give it twice a day, it helps a little bit at a lower dose in the morning and a higher dose at night. Either way, we find that this can be a tremendous resource in patients who have autoimmune diseases, such as another common thing I give it for is what they call Hashimoto's thyroiditis, which is an autoimmune disease against the thyroid, and it works quite well at lowering thyroid antibody levels.
Wow, so it'll lower the antibody levels, and then are there other symptoms that seem to go away when giving this? Like when someone goes on this treatment, is it kind of like an immediate, within a couple of weeks, they'll say, oh, my energy levels are back? Like what type of things are...
Yeah, depending on what they're using it for. Now, one of the comments that I usually get, which has nothing to do with what we're treating them for, they'll say, doctor, I didn't get a flu this year. Doctor, I didn't get a cold this year. Every year I get a flu, I get a cold. I didn't get one this year. I get a lot of comments like that.
Wow.
For patients with Crohn's disease, they just have better bowel movements. They don't have constant bowel movements, so they have less of them, and it's usually a little bit harder than they've had it before. With the MS patients, we get patients tell us, oh, maybe we have somewhat less fatigue, but we get reduced progression of the disease, so it doesn't progress as much as, it slows down the progression, which is important. Fibromyalgia patients report reduced pain, They report more energy, and that's a biggie because fibromyalgia is a very tough thing to treat.
I would imagine.
And the beauty of this stuff, it's not expensive, and
No?
there's very little side effects.
I was going to ask about side effects, so nothing negative, really?
Generally, patients who aren't opioids, if you're taking an opioid, you really can't take this medication. The main side effect that we find are vivid dreams and insomnia, and that tends to go away after a couple of weeks of treatment.
Interesting. Would you say that this type of treatment is what you're most excited for in medicine right now, or
LDN is among the most, but I have two other things that I'm really excited about. I want to stick to what they call the ultra low dose naltrexone.
Let's talk about that.
This is giving naltrexone an extremely tiny dose and elevating the dose every single day. We're finding that many patients with opioid addictions respond beautifully to this. And I mean beautifully. This is a problem that is a big, big, big issue here in the United States.
It's horrible.
You know, the opioid addiction it's a crisis in this country, and we need a way to help our patients with this. And this is a possible way of helping our patients. We've had patients who have tried this ultra low dose, and it's simple. You just take it twice a day, and it's not that expensive.
And
it's a pill.
It's a pill, or we can give it in a liquid. It's because this is such a tiny, tiny dose. You got to get this done right, dose right, because you want to make sure you have the right dose. And we escalate the dose every single day. We start at an extremely low dose, and every day we increase the dose. And after a couple of weeks, we ask our patients, why don't you lower your narcotic level a little bit and see how well you tolerate it? Wow. The ultra low dose naltrexone potentiates the effect. You don't need as much narcotic to get the pain relief that you need. Now, we're not going to get every patient off narcotics, but what if we lowered your dose by half? I think we've done a tremendous service to the patient.
Yeah, 100%.
So even if we can lower the dose by half.
Is this being widely used?
No, it's not. It's a shame because it's not expensive. It's easy to use. The problem is practitioners don't know about it. Even low-dose naltrexone practitioners are not fully aware of the benefits of the ultra-low-dose naltrexone. And I'm hoping to spread the word, especially through podcasts like these.
Yeah, absolutely. So have you actually seen these patients make kind of any full recoveries? Like, do you have any great...
No, I haven't seen full.
Okay.
We've heard stories, and we've have other doctors who have claimed that, yes, they've had some full recovery. I have not, but we certainly have reduction.
How long have you been practicing this, and how long has it even been around?
No, it's been around.
I guess you said there was the doctor in the...
There's literature from, early from 2009, 2008. It's been around for a while. It just has not been widely practiced.
So will you start a patient on a higher dose and then just bring them down?
What we would do is for someone who came in with opioid addiction, you don't want to cut their opioids because obviously we're concerned about withdrawal symptoms. But you want to start them at a very, very, very low dose, and we increase that dose every single day. So it's such a tiny dose that you can just increase it every day. So you start at 1, 2, 3, 4, and every day go up. And then after a couple of weeks, you ask the patient to slowly cut back their opioid dose and see how well they do, and they can just slowly reduce their opioid dose. If we get them completely off the opioid medication, we can continue the ultra-low dose naltrexone for as long as they need. You can be on this medication forever. It's a very low side effect profile.
Is it addictive at all?
No, it's not. Because again, we're not giving them a narcotic. We're giving them an opioid blocker. It's a big difference. A lot of people get scared when they hear the word naltrexone. It's like, but it's
a fancy sounding chemical.
Yeah, and the good news is a lot of doctors, if they're trained, they can easily do this. It's not something that's extremely difficult to do. But unfortunately, with the current state of the opioid crisis and the response of our government agencies, people are scared to even work with it. So we got to reduce that fear, and we got to spread the word. Yeah.
But it seems so. Just so I understand the mechanism. So basically, by giving this, you're shutting down the body's ability to recognize the opioids in the brain, and so then your body will kind of overcompensate and upregulate your natural opioids that you're producing in your own brain.
Well, yeah, it will cause a temporary blockage for 3 to 4 hours.
And that blockage will make
your body make more endogenous opioids. But after a few hours, that blockage stops and your level goes down again.
Interesting, because I think the concern for a lot of these types of therapies, like I know with like testosterone replacement and whatnot, the worry is that like your body would atrophy because you're giving it testosterone, so it's gonna completely forget how to make its own or something like that. But it sounds like this, you're actually doing the opposite. You're making your body stronger and having.
Well, it's a different type of mechanism because with testosterone you're going to get a significant suppression. It's a constant suppression. Mm-hmm. With this, we're doing a burst. We're just doing a few hours of blockage, and that blockage stops after a few hours.
Okay, so it's just like a pulse.
It's a pulse. It's no fear. There's no fear of actually causing your body to have any long-term issues. It's just a pulse.
Oh, well, that's really interesting, and it sounds like the future of what that could hold could be world-changing. I mean, it's.
I think it certainly can. And the other thing that I'm really excited about is the use of stem cells.